While we made our skin incision, remove some of the fat pad, replace our retractors.
Product's been around for 5 years, so kind of
Carefully going into the gutter.
back there. Pretty cold, man.
You see our defect here in the medial-thermal condyle. There are multiple sizers, anywhere from 15 up to 35 millimeters in size. The donor side and the recipient side because of the 1 millimeter press fit. We use multiple sizers to determine which size is appropriate. So come in here and go over top of the defect. I can see that this 20 millimeter sizer will stay within the confines of the condyle and nicely covers our defect. We have our guide pin. Most important here is to make sure that the guide is placed as perfectly perpendicular to the surface as you can. Take a lot of time to make sure you got that placed as well as possible. Once that's placed, do a final check here, looking all around, make sure it's touching perpendicularly. It covers our defect. The next step is then to score the cartilage surface so the reaming doesn't damage the circumferential cartilage that's left behind. So we have our cutting reamer here, or cutting scorer. We're going to score just through the cartilage circumferentially all the way around.
Yeah, exactly.
We got our reamer here, we're set to the same size. We have a depth gauge here that we can adjust to how deep we want to put it. I set the stop to 10 millimeters here. I want about 8 to 10 millimeters depth. Ideally, again, wanting this perpendicular to the side. Normally, in the patient would be using under cool irrigation to help calm down the temperature of the surrounding tissue. Here and take off our cartilage. Be careful to make sure you start the reamer before you hit the tissue. Be very careful about that transition between the types of bone as you get a bit of a kick from the reamer. Looking to make sure I've got good depth and contained all the way around. Looks fairly consistent with respect to the depth all the way around here. This particular set of instrumentation is undersized, so this reamer is a millimeter undersized relative to the plug. We now have a dilator that will upsize that by 0.5 millimeter to compact some of the bone around there, but also give us that 0.5 millimeter of press fit. Carefully impact this. I want to make sure it goes in pretty much to the depth that your ream, so it's down all the way. All the way around. I'm using the slap hammer to remove it. At this point, just make sure there's no other cartilage or tissue that was pushed down into the depth of it by the dilator. So we can use our measurement tool here. Look at the depths all the way around. So usually keep track of the depths at the 12, 3, 6, and 9 positions. I usually check that twice. I want to make sure you put the collared pin inside that you're fine. It helps get the graft out if necessary. So we've got our donor condyle already set up in our workstation. What we do now is that flip to the donor side of the sizing guide here. There's an associated bushing that goes in here that's the same size. One last check here to make sure that we're nice and perpendicular all the way around as best we can, so that allows it to match up with the patient. And again, normally in the patient this would be with cooled irrigation. Coming down to the surface. Lock our base, we'll just move it away. So now we have our plug. want to make sure to mark our orientation before we take the plug out. We'll usually put a mark at our 12 o'clock and at our 3 o'clock. Now we can take our saw. Actually, Keith, if you can just hold on the top there. That just keeps the plug from popping out as we undercut the depth. And you can release it from the clamp. Pop on our port. So the next step now is to measure the depths.
Yeah.
Now roll clockwise. 3 o'clock was 10.5. Alright, so now we can take our plug clamp, insert it cartilage side down. I tend to try to see 2 of the markings on one side and then line with 2 of the markings on the other side. And if I can cut flush across here, now that should be pretty good from my depth point of view. Tighten that up. Check again. So now that we've made those cuts, again we're going to check our depth, see if we've cut enough off or if we need to trim a little bit more. So there we should be good. Good. So we can see on this model we've got the cartilage thickness here, cortical bone underneath, and then some of the transition to the cancellous bone before. And both in reaming this core and reaming into the condyle, you can feel that change in the firmness of the tissue as you're going from cartilage to cortical bone to cancellous bone in this anatomical model. Because this is a press-fit situation, we want to make sure that we can have an ease of insertion though. So one of the things that we'll do is we'll bullet or round the edges of this plug to make for easier insertion. In a live patient with a live graft, we'd also here take some time to pulse lavage this bony surface here to wash out as much of the marrow elements to reduce the immunogenicity of the plug. So once we're done there, we still got our orientation marks on here. And then we'll come back up. This will be kept in its transport medium typically. Keep it here for now. We're going to put our retractors back in. Check to make sure there's no pieces of cartilage blocked in the way and that our edges are nice and smooth. At this point, one of the tricks I like to do, just in case this doesn't go in perfectly smooth, is we'll lay a suture across the depth of the socket here. That way, if perchance it goes in off axis, it doesn't stay jammed in there, I can get it out to reapproximate it. At this point now we're going to get our orientation. I align this with 12 o'clock. Try to start it as perpendicularly as possible. And as best I can, I want to deliver this with thumb pressure, avoid having to use the tamp if I can. In this model, you can see we've got almost a perfectly plush fit circumferentially. And so really the tolerances here should be ideally less than 0.5 millimeter per outer sunken, perhaps up to 1 millimeter at most without disrupting the significant local forces. Once this is in, I'm happy with the position. I'm going to hold my graft so I don't disrupt it. I'm going to cut these sutures for ease, or I'm going to pull these through. Putting our graft in place. There's our final product. At this point now we're making sure we flush out the rest of the knee to get all the bony debris out there. Usually I'll pin close the arthrotomy, take the knee through a range of motion, make sure there's no clicks or catches, and then close the arthrotomy and exit the